My inspiration for choosing healthcare as a career came from my dad. He's a perfusionist and has worked in cardiac surgery for over 30 years. I remember as a child seeing him wake up very, very early with a lot of enthusiasm and energy to go to work that he still has to this day. I also remember the late nights and the many days I didn't get to see him because he was taking care of patients and they had surgeries that went late into the night and into the next morning. So I remember these moments from my childhood, and I think they formulated my interest in being able to help people and work hard while doing it. My work philosophy is very patient-centric. In my practice, I do not rush people. They don't come here to buy a rhinoplasty or buy a breast augmentation. They come here to get an honest and objective opinion by a board-certified plastic surgeon with expertise in facial aesthetics, years of experience, having performed thousands of operations with compassion and commitment to the patients. I feel like they are getting the best possible treatment. When I do an operation, there's no detail that's too small, no millimeter that's too slight. There's no issue that should ever be swept under the rug in surgery and isn't worth considering as many times as you need to just get it right, because at the end of the day, it's somebody's face, it's somebody's body, and it's somebody's life that you're helping and impacting. Spending time with a patient gives me the opportunity to hear their entire story, to make a unique plan for them, and also gives me the chance to educate them so that they know that not only are they going to get treatments that are long-lasting and beneficial, but they're also not going to get treatments that are unnecessary. Post-operatively, I continue spending time with patients. I see patients for suture removal. I see them at every step, at every visit in their post-operative healing. Professionally, I think that is what makes me unique. It's not just the attention to care or the background and the training, but it's the perspective and heightened sense of integrity and servitude that I have for my patients. Personally, I feel like my job is complete when I'm able to make people happy. So to make significant improvements in the way that they look and the way that they ultimately feel about themselves, the way that they view themselves and the confidence that comes along with that is very fulfilling for me. I also find the operations very technically rewarding and challenging, and it allows me to cultivate an artistic part of my brain. I always try to be a perfectionist in my craft, so I never rush, whether with a patient in consultation or with a patient on the operating room table. And I do believe my results are as close to ideal as possible. Truthfully, I love plastic surgery. I feel really happy about being able to do it every day, and it makes me feel a great sense of fulfillment that this is the career that I have. It challenges me. It cultivates an artistic part of myself that used to be expressed with classical piano and now gets to be expressed performing these highly technically demanding but also artistic operations.